Hello, and welcome to AC's Clinic podcast. I'm Maria Kyriacou. I'm a pediatric nurse practitioner. And here with me today is Michelle Orthodoxou. She's our IBCLC, which is an International Board Certified Lactation Consultant here at AC's Clinic. This week is World Breastfeeding Week, and the topic for this year is Prioritise Breastfeeding, Building Sustainable Support Systems. Let's jump right in. Welcome, Michelle. Thank you for joining us today. Thank you for being here at AC's Clinic.
Thank you, Maria. So this year's theme highlights the importance of the infant and maternal health and the environment. So that starts with just even the home support that the mom has within her home. When
That's
she goes
foundational.
home.
It's so important.
Yes. It's very important for not just the mom to know about breastfeeding, what to expect, but also her partner. The partner can be key to help the mom feel
I feel like sometimes we underestimate the value that the father has or the partner has in the...
and even the extended family members who are coming over to help, having a little bit of knowledge of what to expect with breastfeeding
Definitely.
Can make a big impact on the mother. Also, within our healthcare systems, having staff that's knowledgeable about breastfeeding so that they give good support for the mothers when those first few days when they're in the clinic.
Yes, our midwives, thankfully, are
Very
very
good,
knowledgeable.
yes. And also here at the clinic, we support skin to skin, which is very beneficial for mothers and starting breastfeeding.
I feel like not everyone knows how important skin to skin is, and I think you and I both get very passionate about it.
Yes, and I think that a lot of times it's the idea of skin to skin is they think that it's just 5 or 10 minutes with the baby when they're first born, and then they take the baby away and things. What we want is the baby to stay with the mom for at least an hour or until
completion of the first feed, which not everyone knows about.
Yeah, and so sometimes that can be up to 2 hours or longer, and that's okay.
And why is it so important, skin to skin? I mean, yes, we want the baby to feed. What else? Even if a mom is not breastfeeding, why do we still?
It helps transition the baby from uterus to the outside world. It helps mom and to bond with the baby. In general, it helps the heart rate, respirations are more stable. Baby does stay warm.
Yeah.
It also it does kick in the feeding instincts for the baby, which is why we want to do skin to skin as soon as they're born. It also helps to release hormones that aid in milk production. So even extended breastfeeding, not just in the clinic, but once they go home.
Yeah, it's important not just for the first day, but moving forward, the following feeds to come.
Yeah. So we also encourage rooming in so that the mom and baby get to know each other. That can be quite scary for some moms, especially first-time moms, thinking that they're going to be alone in the room, and they're not. It's just for them to get to learn their baby.
Support in the room.
So those are some of the things that the healthcare system can do to help support the mom and baby. Also, it would be ideal if we could follow in Cyprus the 10 steps to baby-friendly hospital initiative. This is very supportive of breastfeeding mothers. So that it would be.
And
ideal.
we try our best to implement that as much as possible. Yeah.
In the community, we can support. We at the clinic support women postnatally with our online support group. Which is very helpful when you go home and you are breastfeeding a new baby and you're not sure how things are going.
I can imagine if you see other moms going through the exact same thing.
Yes, it's nice to talk to someone else who's in that same position.
And to have you as support. And then as well.
Yeah. YESI also offers midwives that do postnatal visits. So that's also quite supportive that what we can do in the community. Even women breastfeeding in public, actually, as a community, that would be really nice to see more often.
We don't see that so much in Cyprus.
No, not so much. But maybe it's because we don't look for it. I think some women think that it's a really big deal and that everyone will notice when you do it. And it's something that, most people don't even recognize that you're doing. And so sometimes it's what we feel that others are thinking. But it would be nice if we could see more of a support in the community from
Just to
restaurants
normalize
and
it, yeah.
cafes and things saying that we support breastfeeding women. That
Whoa.
would be nice.
I would love that.
In the workplace, we would like to see more done in that category. The maternity leave for women,
Absolutely.
I think it was extended from 18 weeks to 22 weeks, which is
That's
a
amazing.
good thing.
It's a good
But
direction we're
if
moving
we could
towards.
go a little bit longer, the World Health Organization recommends for exclusive breastfeeding for 6 months. So to help support that, it would be nice if we could see workplace is giving, which also helps with the government to implement these laws into place. Actually, the EU has a directive that wants the state members to create laws to help support breastfeeding mothers in this aspect. It could even be the pumping that mothers need to do when they go back to work. It's very,
if they
very
have to
difficult.
go in a bathroom to pump or
Yes, no,
I don't
we
know,
shouldn't
some
be doing
shady
this.
area. Yeah.
We should have a clean, safe area for women to pump.
What is the big deal? Why are we so obsessed? And why do we love breastfeeding so much? And
Okay,
why
besides
do we
the
promote it so much?
Of course, we have the benefits that majority of people know, but of course we'll discuss them. For the baby, we see they are sick less. So we see decreased risk of gastrointestinal infections, decreased risk of respiratory infections, otitis media, yes. We see
eczema, asthma,
real quick.
Yeah.
What's that? Sorry.
Eczema and asthma.
Yes, yeah. For the mother, we see a decrease in breast and cancer, cardiovascular disease is less, diabetes. And back to the baby, SIDS. Did you mention that? So
Yes. And obesity.
Yes.
In the future. Yeah.
Yes. There's lots of good benefits for both mother and baby. We see a stronger mother and infant bonding with breastfeeding mothers. We see increased confidence and self-esteem with mothers who are breastfeeding their babies.
And they say it decreases the risk of postpartum depression.
Mm-hmm.
With the right support, of course.
Yes. Yeah, of course. I mean, if we have the right support through the difficult times of breastfeeding, then yes. But it can be quite scary in the beginning. And if you don't find the right support and that you're unsure and you don't know and you feel alone, not know who to turn to.
As natural as it is, it doesn't necessarily come naturally to everyone. It's natural for it not to feel like it's coming naturally, basically.
Which is one of the myths that we'll get to later.
Yeah, okay. Yes. So with all these benefits, and there's community benefits as well.
Yes.
Right?
So in general, it lowers the incidence of illnesses and chronic diseases for later, for both mother and baby.
And that's safe.
Which means that there is, less doctor visits, less hospitalizations, less prescriptions given out. So overall, the total cost to the public health is decreased. So it saves money.
For mom and for the community as well.
Yeah.
There's so many benefits to the mom, to the baby, to the community.
Environment.
Why?
Did we even mention the environment? There's no production. So we're using less water. We're not using plastic.
Absolutely.
We're not using trucks, transportation to get products, anywhere. So in general, it's great for the environment.
So why, are there so many barriers? What do you think are the barriers? Why doesn't, if it's so beneficial, why doesn't everyone do it? What's your experience?
Sorry.
At least here in Cyprus, or in general.
In general, I think one of the biggest barriers is the separation of mother and baby at birth. It's
important.
I mean, it's changing for sure. It's changing in Cyprus because we are promoting skin to skin. We hear about it more. So there was a new review that talks about
Cochrane review. They studied the benefits of skin to skin, and they came out with a statement that it's almost unethical not to offer it or not to encourage it and promote it. And
Yeah. So
Implement it.
but yeah, so if we're separating mom and baby early on, they're not getting that, bonding that they need in the beginning, and they're not getting the time that it needs to take to learn how to breastfeed. And in the first couple of days, it's really important. I think one of the common problems with the separation is we think that mothers don't have enough milk. So we separate the mom and baby. And I don't mean separate that we keep them completely, but we want to keep the mom and baby together during skin to skin, keep rooming in with the baby so that anytime the baby is showing signs they want to eat, that mom is there to pick the baby up and to feed, all the while with the nurses and the midwives around.
For support and for safety. So there's a separation at birth, at delivery. That was first 2 hours, like the golden hour.
Yeah.
But then after that, it's a separation that continues throughout their stay here and even at home.
Yeah.
As much contact as possible.
Yes, yeah.
just to-
And do continue skin to skin, even whenever you feel things are difficult with breastfeeding.
yeah,
Yeah.
very helpful. Yeah. Another barrier. So with the separation, naturally might come supplementation.
Yes.
Can you talk a little bit about that and why can it be a barrier? What can be the consequence of
with supplementing?
unnecessary?
Yeah.
Right. There's medical reasons for
Yeah, there's-
supplementation at times. And
Right. I think part of it is not understanding how our body works and how our body makes milk. So the first couple of days, I think it's thought that maybe we don't have enough milk, that our bodies aren't producing the milk, but it's producing enough. Babies need very little in the first couple of days. We think that they feed more for the protective factor of the colostrum, and not so much they need to have these nice big full meals in the first couple of days. Their bellies are tiny, they're small, so they don't need very
first
much
24 hours.
at all. And then we get babies are learning to feed, so they're not going to be perfect as soon as they do their first breastfeed.
Mommy's learning, baby's learning.
So there are times when the baby goes onto the breast, they might fall asleep a little bit early, and then you lay them down, and half an hour later they're waking up and they want to eat again. And in our head, we automatically think that, oh, it's because I don't have enough milk.
Baby just ate. What happened?
But it's just to take a step back and realize that the baby is learning. You just pick your baby up, keep them close, ask for help when you need, and a lot of it is also they've been in this nice, tight, cozy womb for 9 months, and they have to learn to be separated from us again. So they just want to come back for some cuddles and to feel safe and to secure. And also doing breastfeeding at that time kind of covers that a little bit. Babies like to suckle. They have a very high need to suckle. So skin to skin, breastfeeding on demand in those first couple of days is quite normal. There are things that we can look at to know if baby is getting enough milk. Our expectations are quite low for babies on the first couple of days. We don't expect them to make lots of pees and poops, but
Tell us.
so on the first day we only expect about 1 pee and 1 poop, and that's okay.
First 24 hours.
And it'll increase as the days go on. When the milk starts coming in, then we start to see maybe baby feeding a little bit better, suckling a bit more. You start to feel more comfortable and holding the baby even.
Yes.
So this is what we need those first couple of days for, so that when the milk does come in, that big rush of milk comes in, you're feeling a little bit
ready.
more comfortable. The baby's feeling a little bit more comfortable.
Yeah. So the real medical need is if the baby's not meeting the minimum output urine stool,
Right.
or if baby's weight loss is significant, and what's significant, over 10%.
Yes. Yeah.
And when do we want to see babies reach their birth weight again?
Between 10 and 14 days usually. And that's something I wanted to talk about is, maybe this is for babies who are born full term, of course.
Yes.
So
Healthy babies.
yeah.
Okay. Also, another barrier that I've seen here, and
Yeah.
I'm Cypriot of origin as well, so I can probably say this. We are obsessed with food. I think we love food. It's a part of our social life. We talk about it a lot. It's part of our daily conversations with everyone. Did you eat? What did you eat? Recommending, I don't know. We love food.
Yeah.
So I think that pours over into our babies, and especially the older generation. Even with their adult children, they're like, "Did you eat? You didn't eat for 5 hours. Like, here,
Yeah.
eat."
Yeah.
So even more so with babies who were already overprotective of little babies in Cyprus.
For sure.
Naturally, we kind of have this anxiety about food. So if the lack of maybe adequate education, not just in the mom and the parents, but also in the community, and then the culture doesn't allow for us to put the mother at ease. I think she gets mixed messages all around.
It's hard because,
lots of anxiety.
If you've been breastfeeding, sitting there breastfeeding for, 30, 40 minutes, and then you think you're finished. Everyone around you thinks you're finished breastfeeding. You lay the baby down, and then and 20 minutes later, they're crying again, or they're eating their hand, they're searching. And then you have the comment of, "Oh, didn't you just feed the baby?" Or
Baby wants more. Baby's hungry.
maybe you didn't have enough milk, or and then instinctively we're
you sure you
saying,
have it?
"Oh, we need to feed the baby."
And it comes from love, right?
Yeah.
It's, of course, but
Sure.
there's room for growth, I guess, in general.
Yeah.
For sure.
Yeah. I think we see the more we see breastfeeding, the more we will normalize how it goes, how feedings are, because I think that's the expectation of breastfeeding. This is a barrier, I think, that leads into this is the knowledge of the expectations of breastfeeding. In our heads, we think that baby wakes up, we put the baby on the breast, we feed them, and then they go back to sleep. Just like this is kind of like what maybe formula-fed babies or bottle-fed babies, maybe. So these breastfed babies are quite a bit different than formula-fed babies. So
Or
we
on
need
their
to
schedule,
move away
yes.
from what's normal for this type of baby and what's normal for a breastfeeding baby. And they feed very frequently, very often, especially in the early weeks. There's lots of growth spurts in the first 6 weeks that impacts how often they breastfeed as well. Breast milk is easily digested, so they eat more, they poop more, and then they want to go back to the breast.
Just a thought, in the early days, I don't know if this is true, but baby just was connected to the placenta, getting continuous feeds. So it's natural for baby then to kind of want very, very, very frequent feeds. And
Sure.
the transition is more smooth that way. Am I making that up?
No. I think that's true. I mean, in breastfeeding in general, it covers more than just nutrition too, I think.
Yeah.
It's a connection for the baby to mom to feel safe, secure. So I find moms, when they do look past breastfeeding for just the nutrition, they do find it a little bit easier, because then you have a reason, for many reasons, to breastfeed, which in general will improve the breastfeeding in the early weeks.
Once they feel that reassurance.
Yeah,
and-
because if we have the expectation that baby's just going to feed and be done for 2 or 3 hours, it's not very likely that this happens. They're very irregular with the way that they feed. So, it's very normal for a baby to feed 8 to 12 times in a 24-hour period. In our heads, we automatically say 2 to 3 hours, but it doesn't always work that way. They cluster feed. So there's times in the day where they'll feed every 20 or 30 minutes, 2 or 3 times in a row, and then they may have a period where they sleep a bit longer.
And that's all normal.
Yes, very normal.
So we just have to work on reassurance. And
Yeah.
yes. When I first moved to Cyprus, one of my culture shocks was babies are literally just born, and family will be like, baby's crying, is baby hungry? It's like, no, baby was just born. It's not every cry means hunger,
Yeah.
right? This baby could be crying because was just exposed to the cold and
Yeah,
the,
yeah.
away from mommy. So maybe, yeah, it's so much more complex. So I
Yes.
think that we just want baby to always be content, calm, but it goes in deeper than that.
Some of the myths.
Okay, I mean, the number one myth
There's
is,
loads of myths, but
what's the
I think the
top
number
myth?
one is that I'm not going to have enough milk.
Yeah, or milk's not good enough.
Yeah, the milk's not good enough. There's not enough fat. There's not enough this or that. But simply not true. A majority of women, make enough milk for their babies. So it's the mismanagement in the first several weeks of breastfeeding that can actually, yes, cause a woman to not have enough milk. So even it's a myth that we won't produce enough milk, but there are plenty of women that several weeks in, they may not be producing very much milk, and that's because of this mismanagement of it and how we get started off with breastfeeding. So some of the things that we want to do is keep mom and babies together, the skin to skin, rooming in, yes.
And all that promotes the
and
adequate milk
feed
that's
and-
needed. I mean, it's supply and demand. That's how you
Yes,
explain it to parents. right?
Exactly.
Yeah. The less demand, the less supply.
Exactly. And it is hard because there are times where you are actually exhausted. And, maybe you want to give, just that one bottle. And that's okay. That's fair enough for moms if they want to do that. But that is where sometimes we get this vicious cycle. One bottle means that the baby didn't breastfeed, so no stimulation during that time to the breast. And so that sends the message back to the mother's brain, okay, we don't need this milk, so let's decrease it a little bit. And then the next time there's maybe just a little bit less milk, and then we do another top up. And so it's this vicious cycle that continues. Another myth.
My breasts are too
size
small.
of the breast, the size of the nipples. It does not matter the size at all.
Nope.
Big, small, breast, different shapes, nipples. They're all fine. It's not going to cause you to not be able to breastfeed. It can be challenging for some women with larger breasts. They can find it more challenging, of course, but it's not going to.
You need some help with positioning,
Yes.
kind of learning
new positions, getting someone to help you, how to show you how to hold the baby, to give you good support. But again, it's also practice and knowing where you need the support. And in the beginning, it can be, you have to find lots of pillows and blankets to put in certain areas, and that's overwhelming in itself.
And it
but
feels
it's
unnatural
not
and all that,
always. It won't always be that way. It's just those first few weeks until you get used to everything.
I think sometimes the hardest part is just mom learning how to hold it properly.
Especially if you haven't held a newborn.
There's a lot of fear surrounding baby's head. And
Squeezing too
nose
hard and
and-
things, and babies actually need a lot of good support. Back to the size of the breast, it does not matter about how small they are either. That's the adipose tissue is what makes up our size of the breast. So small breasts can breastfeed babies just fine. Size of the nipples can also we don't need an actual nipple to breastfeed. There's the milk ducts and the pores come out in all different areas.
It's not like a bottle where the baby sucks on the nipple of the bottle.
Exactly.
you can explain
So there are some women who might have flat nipples or inverted nipples, and they can breastfeed. But again, maybe there's a little bit of difficulty in the beginning, starting out. Babies need a lot of that oral stimulation at the top of the mouth, and sometimes that's part of the impact of an inverted or a flat nipple.
Can I drink coffee? Can I eat what I want? What are the
Diet,
myths
yeah.
surrounding diet with breastfeeding?
Basically, the diet, you should eat whatever you like. You should eat a well-balanced, nutritious, daily meal. You need extra 350 to 500 calories a day that you're burning, that your body is burning those calories. So you need those extra calories. Mostly it's for yourself, because your body is going to actually pull away from your nutrients and your vitamins and things to make milk for your baby. So it's mostly for you to feel healthy and to not get sick easier. If you're not eating well, if you're not drinking well, then
Absolutely,
you are more
yes.
prone to
Have
being
no
tired
energy,
and exhausted,
yeah.
and yeah.
Yeah. What other myths? I think
Okay.
that's about, yeah. What
Yes.
advice do you have for maybe someone who's pregnant, who's thinking about breastfeeding, or who's thinking about conceiving?
I think the best thing that you can do is just start reading at least about breastfeeding and what's normal, and talk to women who have breastfed, and not just the ones that have. You do. When we talk about breastfeeding, I think moms usually hear the bad stories, or they stick in their heads more. So make sure you talk to a wide variety of women who have breastfed, so you can see what's normal. And I think the education part is really important, because to know what to expect from your baby in those first few days, critical days of when you're first starting, and then in those few hard weeks that come afterwards, because breastfeeding is overwhelming, and it's exhausting. It takes a lot of time, and you need a good support system. So the ones who are going to be around you supporting you, it's also important for them to know what's normal with breastfeeding.
The more you teach yourself, the more you can teach
Yes.
those around you, and the more you can advocate for yourself
Yeah.
when you have
Yeah,
the
yeah,
baby.
yeah, yeah.
And everything.
And reach out as soon as you feel breastfeeding is painful. Breastfeeding shouldn't actually be painful, and I think that's another maybe common myth, that in the first weeks it's always painful, but
Or that it's never painful.
yeah. So I mean, there's a difference in pain, because we can have normal nipple stretching pain, which happens in the first week, but again, that's only on the initial latch. During that feed, you should feel that breastfeeding is comfortable. So even within that first week, if you're feeling pain throughout a breastfeed, something may not be quite right.
yellow
So
flag
you just
kind of.
need,
Yes.
and majority of the problems come from the positioning of the baby. The latch is completely dependent on the position of the baby.
Even one feed can kind of
Yes, yeah, yeah.
throw you off. Yeah.
Yeah. Yeah, it's like when a shoe doesn't fit and it's constantly rubbing on the back of your heel, we have the skin breakdown. It's the same with the baby's tongue, and on the roof of the baby's mouth. So if there's constant friction, it'll cause breakdown.
Yeah.
And one feed is enough
good analogy.
to do that. Yes.
Well, this was a good chat.
Yes, I think so.
And it serves as a reminder that it really doesn't, it takes a village to help
Yes.
someone breastfeed. You need the support. It's not just you and the baby.
Yeah.
You need without the support, it's very, very difficult.
Yeah, no, it's
and
not
here at
something you
AC's
can do
Clinic,
alone.
you offer our breastfeeding prenatals classes.
Yeah. Would you just if you're interested, then just give the clinic a call, and we can arrange for prenatal breastfeeding education class, where I talk about the normal expectations of a breastfeeding baby, how to know if your baby is feeding well, and just any general questions that you might have that you're concerned about.
Very important,
Yeah.
Thanks for being here, Michelle.
Thanks.
You're such an asset. Insight for us in our
Thank
clinic
you.
over here. Thank you. Bye-bye.
Thank you.